Could catching cancer early save your life? Absolutely. Today we're discussing essential cancer screenings and prevention strategies every senior over 50 needs to know. Welcome. Today I will guide you through cancer screening recommendations, risk factors, early warning signs, and proven prevention strategies specifically designed for adults over 50 years old. Cancer is the second leading cause of death in America. But here's some empowering news. Many cancers can be prevented, and early detection dramatically improves survival rates always. Screening gives you the best chance of finding cancer early when it's small and before it has spread, when treatment is most effective and outcomes are best overall. At least 18% of all cancers diagnosed in the U.S. are related to the following: excess body weight, physical inactivity, excess alcohol consumption, or poor nutrition. All the above can be prevented today. Today we'll cover the 5 major cancer screenings for seniors, understand your personal risk factors, recognize early warning signs, and learn powerful prevention strategies you can start immediately. This information empowers you to take control of your health. Knowledge combined with action can save your life or the life of someone you love dearly. Let's start with screening number 1, colorectal cancer screening. This includes colonoscopy, stool tests, and other methods to detect colon and rectal cancer early when treatment is successful. The American Cancer Society recommends starting regular colorectal screening at age 45. If you're in good health, continue screening through age 75 for best outcomes. Screening options include colonoscopy every 10 years, annual stool-based tests like FIT or FOBT, or flexible sigmoidoscopy every 5 years. Discuss which option suits you best today. Colonoscopy is considered the gold standard. It examines the entire colon and can remove polyps during the procedure, preventing cancer before it even starts developing fully. Question: is colonoscopy preparation difficult? It's the least pleasant part, requiring clear liquid diet and bowel prep. But it's temporary, and the life-saving benefits far outweigh discomfort. Screening number 2, breast cancer screening for women. Mammograms remain the best tool for detecting breast cancer early, before you can feel any lumps at all. Women ages 50 to 54 should get mammograms every year. Starting at age 55, switch to every 2 years or continue yearly. Discuss preferences with your provider. For breast cancer screening, mammograms are recommended from ages 40 to 74. For some patients over 75 in good health with 10-year life expectancy, continued screening may be recommended. Know how your breasts normally look and feel. Report any changes immediately. New lumps, dimpling, nipple discharge, skin changes, or persistent pain in one breast area. If you have higher than average risk, family history of breast cancer, genetic mutations, or previous chest radiation, talk to your provider about earlier or more frequent screening today. Meet Barbara, 68, who felt perfectly fine with no symptoms whatsoever. Her routine mammogram detected a tiny tumor, less than 1 centimeter, before she could feel it. Because Barbara's cancer was caught so early, she needed only a lumpectomy and short radiation course. No chemotherapy required. She's been cancer-free for 5 years now. Subscribe to our channel now. We share life-saving senior health information weekly that empowers you to take charge of your wellness journey confidently every day. Screening number 3, lung cancer screening. The American Cancer Society recommends yearly lung cancer screening with low-dose CT scan for people ages 50 to 80 who meet criteria. Screening is for those who currently smoke or used to smoke and have at least a 20-pack year smoking history. 1 pack year equals smoking 1 pack daily for a year. If you smoked 2 packs daily for 10 years, that's 20 pack years. If you smoked 1 pack daily for 20 years, same calculation. Do the math with your doctor. Before deciding to be screened, discuss with a healthcare professional the purpose, benefits, limits, and possible harms of screening. Also discuss smoking cessation resources if you still smoke. Low-dose CT scans can detect lung cancer at very early stages when it's highly treatable. Early-stage lung cancer has much better survival rates than advanced disease. Question: do CT scans have radiation exposure? Yes, but low-dose CT uses minimal radiation, and the cancer detection benefits far outweigh the very small radiation risk for eligible people. Screening number 4, prostate cancer, screening for men. Starting at age 50, men should talk to healthcare providers about the pros and cons of PSA, prostate-specific antigen, testing to make informed decisions. The PSA test is a simple blood draw measuring prostate-specific antigen levels. Elevated levels may indicate cancer, but also benign conditions like enlarged prostate or infection. African American men and men with father or brother who had prostate cancer before 65 should have this discussion starting at age 45 due to higher risk factors. Prostate cancer screening, if performed at all, should not be performed after 69 years of age according to some guidelines, though recommendations vary. Discuss your individual situation carefully. Meet Frank, 67, whose annual physical included PSA testing. His level was elevated, prompting further evaluation, including biopsy, to determine if cancer was present or not. Frank's biopsy revealed low-grade prostate cancer. After discussing options, active surveillance, surgery, or radiation, Frank chose careful monitoring since his cancer was slow-growing and unlikely problematic. Frank gets regular PSA tests and exams. His cancer hasn't progressed in 4 years. He's living normally without treatment side effects that surgery could have caused. Please share this video with friends or family who need this information. Together we can save lives through awareness, early detection, and prevention efforts. Screening number 5. Cervical cancer screening for women. People with a cervix should get a primary HPV test every 5 years, though Pap smears remain alternative options. People over age 65 who have had regular cervical cancer testing in the past 10 years with normal results should not be tested for cervical cancer. Once stopped, don't restart. Those with a history of serious cervical precancer should continue testing for at least 25 years after that diagnosis, even if testing goes past age 65. Women who've had a hysterectomy removing the cervix for benign reasons don't need cervical cancer screening. However, those who had hysterectomy for cancer should continue screening. Meet Patricia, 71, who'd had normal Pap smears for 30 years. Her doctor explained she could stop cervical cancer screening since she was over 65 with excellent history. Patricia was relieved. One less medical procedure to schedule. She asked excellent questions to ensure stopping screening was truly safe in her specific situation before agreeing. Question: what about skin cancer screening? There's no routine full-body screening guideline, but examine your skin monthly and see a dermatologist annually if you have risk factors. Now let's discuss cancer risk factors. Understanding your personal risk helps you make informed decisions about screening frequency and prevention strategies you should prioritize most. Risk factor number 1, age. As you age, your risk of developing certain types of cancer increases. Most cancers occur in people over 65, though cancer can happen at any age. You can't control your age, but you can control other risk factors. This is why screening becomes crucial as you get older. Catching cancer early matters enormously. Risk factor number 2, family history and genetics. If close relatives, parents, siblings, children, had certain cancers, your risk increases. Some families carry genetic mutations like BRCA genes significantly. Tell your doctor about family cancer history. You may benefit from earlier screening, more frequent testing, or genetic counseling to assess inherited cancer risk factors accurately today. Question: can I get cancer even if no one in my family has had it? Absolutely. Only 5 to 10% of cancers are hereditary. Most occur in people with no family history. Everyone needs screening regardless of family history. Risk factor number 3, tobacco use. Smoking significantly enhances the risk of various tumors: lung, throat, mouth, esophagus, bladder, kidney, pancreas, stomach, and even some leukemias. Tobacco is extremely harmful. If you smoke, quitting is the single most important thing you can do to reduce cancer risk. It's never too late. Even quitting after 50 significantly improves your health. Risk factor number 4, excess body weight and obesity. At least 18% of cancers are related to excess body weight. 15 types of cancer have been linked to being overweight or obese, including breast, colorectal, kidney cancers. Getting to and staying at a healthy weight is important to reduce cancer risk and other chronic diseases like heart disease and diabetes. Even modest weight loss helps significantly. Risk factor number 5, physical inactivity. Several types of cancer have been associated with physical inactivity. Being active can help reduce your cancer risk by helping with weight control and improving hormone levels. Like this video if you're learning valuable information, and subscribe to stay informed about health topics that can truly extend and improve your life significantly. Risk factor number 6, alcohol consumption. Alcohol use is the third most important preventable risk factor for cancer, after tobacco use and excess body weight. It increases risk for multiple cancer types. People who do choose to drink alcohol should have no more than 1 drink per day for women or 2 drinks per day for men. Less is better. None is best for cancer prevention. 7. Poor diet. Diets high in processed meats and low in fruits and vegetables increase cancer risk. Research shows diets with more than 18 ounces of red meat weekly can increase cancer risk. Risk factor number 8, sun exposure and UV radiation. Excessive sun exposure causes most skin cancers, including melanoma, which can be deadly if not caught early and treated. Risk factor number 9, environmental and occupational exposures. Asbestos, radon, certain chemicals, and workplace hazards increase cancer risk. Test your home for radon if applicable in your area. Risk factor number 10, chronic infections. HPV, hepatitis B and C, and H. pylori bacteria increase cancer risk. Vaccines exist for HPV and hepatitis B. Discuss with doctor if appropriate. Meet Helen, 65, who reviewed her risk factors with her doctor. She had family history of breast cancer, was 20 pounds overweight, and drank wine nightly. Helen made changes, lost 15 pounds through diet and exercise, cut alcohol to weekends only, and increased her mammogram frequency. She took control of her modifiable risks. 2 years later, Helen's mammogram detected early breast cancer. Because of her increased vigilance and healthy changes, it was caught early and successfully treated completely today. Now let's discuss early warning signs of cancer. While screenings catch cancer before symptoms appear, knowing warning signs ensures you seek medical attention promptly when needed. Warning sign. Number 1. Unexplained weight loss. Losing 10 or more pounds without trying can signal various cancers including pancreatic, stomach, esophageal, or lung cancer. See your doctor. Warning sign number 2. Persistent fatigue that doesn't improve with rest. Extreme tiredness can indicate leukemia, colon cancer, or stomach cancer, as cancer cells drain your body's energy. Warning sign number 3. Fever or night sweats, especially recurring or prolonged. These can indicate blood cancers like lymphoma or leukemia, affecting your immune system's normal functioning. Warning sign number 4. Pain that doesn't go away. While pain has many causes, persistent or worsening pain, especially bone pain or headaches, warrants medical investigation always. Warning sign number 5. Skin changes. New moles, changing moles, sores that won't heal, or jaundice, yellowing skin, require prompt dermatologist or doctor evaluation immediately today. Share this life-saving information. By sharing, you're helping friends and family recognize symptoms early when treatment is most effective and outcomes are best overall. Warning sign. Number 6. Changes in bowel or bladder habits. Persistent diarrhea, constipation, blood in stool, blood in urine, or changes in urination patterns need medical evaluation promptly. Warning sign number 7. Unusual bleeding or discharge. Coughing blood, blood in vomit, unusual vaginal bleeding or bloody nipple discharge all require immediate medical attention today, always. Warning sign number 8. Lumps or thickening in breast, testicles, or anywhere on your body. Any new growing or changing lump should be evaluated even if painless initially. Warning sign number 9. Difficulty swallowing or persistent indigestion. While often benign, these symptoms can indicate esophageal or stomach cancer, especially if worsening or accompanied by weight loss. Warning sign number 10. Persistent cough or hoarseness. A cough lasting more than 3 weeks, especially with blood or voice changes persisting over 2 weeks, warrant medical evaluation today. Meet Edward, 70, who ignored his persistent cough for 4 months, assuming it was just a cold. When he finally saw his doctor, lung cancer had progressed to advanced stage. Edward's experience reminds us that early symptoms matter. Don't assume symptoms will go away. If something persists for weeks, get it checked. Early detection truly saves lives. Question: aren't these symptoms common and usually not cancer? Yes, most are benign, but the only way to know is medical evaluation. It's better to check and find nothing than ignore cancer. Question: how often should I do self-exams at home? Check your skin monthly for new or changing moles. Women should be familiar with how breasts normally feel. Men should check testicles monthly. Report any changes immediately. Now for the empowering part: prevention strategies. While we can't prevent all cancers, Healthy lifestyle choices dramatically reduce risk across multiple cancer types effectively today. Prevention strategy. Number 1. Quit smoking and avoid tobacco. Stay away from all forms of tobacco. Quitting at any age reduces cancer risk. Resources available: 1-800-QUIT-NOW or smokefree.gov. Prevention strategy number 2. Maintain a healthy weight. Get to and stay at a healthy weight throughout life. Even losing a small amount of weight has health benefits and is a good place to start. Focus on sustainable changes, not crash diets. Eat smaller portions, choose whole foods over processed ones, and find an eating pattern you can maintain for life long term. Prevention strategy number 3. Get moving with regular physical activity. Get moving with regular physical activity. Aim for at least 150 minutes of moderate activity weekly. That's just 30 minutes most days. Limit time spent sitting, watching TV, and using screen-based entertainment. Take walking breaks hourly. Use stairs when possible. Every bit of movement helps reduce cancer risk. Physical activity helps reduce cancer risk by helping with weight control, improving hormone levels, and strengthening your immune system. It also prevents heart disease and diabetes too. Prevention strategy number 4. Eat a healthy diet rich in plants. Eat healthy with plenty of fruits and vegetables. Fill most of your plate with colorful vegetables, fruits, beans, and whole grains for cancer prevention. Try to make your plate a rainbow of colors. Different colors provide different protective compounds. Aim for 5 servings of fruits and vegetables daily for optimal health benefits. Limit red meat to no more than 18 ounces per week. Choose fish, poultry, or plant proteins more often. Avoid or limit processed meats like bacon, sausage, hot dogs, and deli meats significantly. Prevention strategy number 5. Limit alcohol consumption. If you drink alcohol at all, have no more than 1 drink daily for women or 2 for men. Best for cancer prevention is not drinking alcohol at all. 1 drink equals 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. Many people pour more than standard servings without realizing it. Prevention strategy number 6. Protect your skin from sun damage. Seek shade, especially between 10 a.m. and 4 p.m. Wear protective clothing, wide-brimmed hat, and sunglasses. Use broad-spectrum SPF 30+ sunscreen. Apply sunscreen generously 30 minutes before going outside. Reapply every 2 hours and after swimming or sweating. Don't forget ears, neck, hands, and top of feet, commonly missed areas. Avoid tanning beds completely. There's no such thing as a safe tan. Tanning beds emit UV radiation that significantly increases skin cancer risk, especially melanoma risk. Prevention strategy number 7. Get vaccinated. The HPV vaccine prevents cancers caused by human papillomavirus. Hepatitis B vaccine prevents liver infection that can lead to liver cancer later in life. While HPV vaccine is typically given to younger people, adults through age 45 may benefit. Discuss with your doctor. Hepatitis B vaccine is recommended for all unvaccinated adults under 60 who are at risk for infection. Prevention strategy number 8. Avoid risky behaviors and infections. Practice safe behaviors. Don't share needles. If getting tattoos or piercings, ensure sterile equipment. These reduce hepatitis and HIV risk. Prevention strategy number 9. Get adequate sleep. Research shows people who sleep less than 6 hours nightly have increased cancer risk. Aim for 7 to 9 hours of quality sleep each night. Prevention strategy number 10. Manage stress. Chronic stress weakens your immune system. Practice stress management through meditation, prayer, yoga, hobbies, or spending time with loved ones you cherish most. Let's recap. Get screened regularly. Colorectal, breast, lung if eligible. Prostate discussion for men. Cervical until age 65. Screening saves lives by catching cancer early when most treatable successfully. Know your risk factors: age, family history, tobacco, weight, inactivity, alcohol, diet, sun exposure, infections. Understanding your risks helps you make informed decisions about your health journey. Recognize warning signs. Unexplained weight loss, fatigue, fever, pain, skin changes, bowel or bladder changes, bleeding, lumps, swallowing difficulty, persistent cough. Don't ignore symptoms. Get evaluated promptly today. Practice prevention. Quit tobacco, maintain healthy weight, stay active, eat plants, limit alcohol, protect from sun, get vaccinated, sleep well, manage stress. You have the power to reduce your cancer risk significantly today. Thank you so much for investing this time in your health today. By watching this video, you've taken an important step toward protecting yourself and living your healthiest, longest life possible. Please subscribe to our channel and hit that notification bell. We share practical, evidence-based senior health information weekly that empowers you to take charge of your wellness journey confidently every single day.